This is an anatomy review for the hip and the pelvic girdle for Ther X1. So the main structures of the pelvis include 4 joints. We have 2 sacroiliac joints, so one on our right and one on our left, our pubic symphysis, which is anterior, and then our lumbosacral joint. The function of the pelvis is to support the weight of the body. It receives ground reaction forces because this is typically where our center of mass is located. It's very close to the pelvis. If you look at biomechanical research reports, they describe the center of mass as typically being about 10 centimeters below the level of the umbilicus. The pelvis also supports and protects the pelvic viscera, so our internal organs. It provides attachments for muscles within the area as well as a lot of ligaments, and it makes up a bony portion of the birth canal in our female patients. Starting with the sacroiliac joint, it is a synovial non-axial joint. Its function is to provide stability and then to offset the load of the trunk to the pelvis. There are several motions that occur at the sacroiliac joint, but I want you to keep in mind that there's a very high level of stability at this joint. They have estimated that there's only about 4 degrees of movement at our sacroiliac joint, so very, very small. So the motion that occurs at our SI joint occurs with sacral movement relative to the iliac bones. So we have 2 directions. So we have nutation, which is pictured in figure A on the left, and counter nutation. So if we start where this darker orange line is, if this is our position of our pelvis, where we start in our SI joint, with the movement of nutation, the superior aspect of our sacrum moves anterior and inferior, and then the coccyx does the opposite. If we were talking about counter nutation, we get the opposite movement. So again, starting with our dark orange line as our reference point, with counter nutation, the superior portion of the sacrum here is going to move posterior as well as superior, and again the coccyx does the opposite direction. So to review some important bony landmarks, the base of our sacrum is going to be at the proximal portion here. This is where a lot of the load is transmitted through the pelvis. We have our sacral promontory, located here. This is the most prominent portion of our first sacral vertebrae. This is also considered the roof or the top of our pelvic cavity. We also have our pelvic surface, which in this angle is a little bit hidden, but it's going to be in this anterior portion of our pelvis. I wanted to show you a different view of our sacrum so we could identify some other spots here. So we have our superior articular processes located right here, and this is between our lumbar segments and our sacral segments. Okay, so that's going to be on the superior aspect of our pelvis. We have our ala, which is located just lateral to that spot there. We have our posterior foramina. This is where our nerve roots will come out and innervate our sacral region, so this would be S1 through S4. Our auricular surface here, this is where our sacroiliac joint will actually be articulating with the ilium. So that is the purpose of our auricular surface. Moving on to the ilium, we have our iliac crest here, our iliac fossa on the medial side of the pelvis. We have our anterior superior iliac spine. It's not labeled here in the diagram because I wanted to make sure that you could have some of our other labels. We have our posterior superior iliac spine, or PSIS. We have our anterior inferior iliac spine anteriorly, and our posterior inferior iliac spine posteriorly. We also have our greater sciatic notch. This is where the piriformis as well as our sacral nerves and arteries will pass through. And lastly, our greater sciatic foramen, which is not labeled on this diagram, is actually this space here that's created by our greater sciatic notch, and this is where the piriformis will pass through. What's not pictured on this image is the ligaments that will actually make up and form that foramen. Moving on to our ischium, which is going to be the inferior part of our pelvis. So we have the body of the ischium, as well as our ischial ramus, would be one side, rami, bilaterally. We have our lesser sciatic notch. This is where our pudendal nerve will pass through, as well as some of our deeper hip rotator muscles will also pass through this area. We have our ischial spine right here. Again, this is an attachment for some of our pelvic ligaments as well as some of our deep rotator muscles of the hip. And lastly, our ischial tuberosity. We know that this is often called our sits bones, but this is where we have a lot of muscle attachments. We have our hamstrings that attach there, our adductor magnus, our quadratus femoris attaches there. So several muscles attached to our ischial tuberosity. Moving on to our pubis, which is going to be on the anterior portion of our pelvis. We have our superior and our inferior pubic rami. We have our pubic symphysis, which we have a better picture of that later on in this review, would be the articulation between our right and our left hemipelvis. We have our pubic tubercle, located anteriorly here. This should say acetabulum. Okay, we can't see it on this view because we're looking on the medial side of this pelvis, and then our obturator foramen located right here. Within our obturator foramen, this is where our obturator artery, nerve, and vein will pass through, as well as our obturator muscles that help with external rotation of the hip. So moving on to our ligamentous structures. So we have a lot of ligaments within our sacroiliac segment of our body. It's because it needs additional stability. So we're going to start with our anterior sacroiliac ligament, located right here. So this is an anterior view of the pelvis. Okay, this anterior sacroiliac ligament is on the anterior surface of the pelvis. It's connecting our sacrum to our ilium of our pelvis. Our interosseous sacroiliac ligament, this is not pictured in this image here. It's a deeper, shorter ligament. Research has said that there's no significant contribution to mechanical stability by this ligament, but it is thought to have proprioceptive benefits. We will move to the posterior aspect to look at our posterior sacroiliac ligament. We have our sacrotuberous and our sacrospinous ligaments that we can see here on our anterior view. We can also see them in our posterior view. So these ligaments help provide stability to the pelvis, and they also help resist our nutation and counter-nutation motions. Our last ligament listed here is our iliolumbar ligament. So as the name kind of describes it, it attaches the ilium to the lower lumbar segments of the spine. This also helps resist our nutation movements as well as side bending. Okay, this is a posterior view of our pelvis. So here we can see our short posterior sacroiliac ligaments and our long posterior sacroiliac ligaments. Okay, these again are going to resist our nutation type of movements, again providing stability. We can again see our sacrospinous and our sacrotuberous ligaments listed here, as well as our iliolumbar ligaments. So the overall importance of these sacroiliac ligaments is to provide stability to the pelvis and resist that nutation and counter-nutation movements. Coming back to our pubic bone, I wanted to provide an anterior view. So we have our pubic symphysis here anteriorly, and we have a superior and an inferior pubic ligament that provides stability to that joint. I thought this was a different view to show you our articulations here between our two pubic bones. So the general motions of our pelvis, we did talk about our nutation and counter-nutation movements. You did discuss this in kinesiology with Enid about our anterior pelvic tilt, posterior pelvic tilt, lateral tilt, and pelvic rotation. So I'm going to have you refer to her lectures for further information about that. So we're going to quickly jump to the hip. So our primary motions at the hip are going to include flexion and extension. You may hear some people describe hyperextension as a movement at the hip. We have our ab and adduction, as well as our medial and lateral rotation, also known as internal and external rotation. Going through our landmarks of our femur, so we have the head of the femur, we have the neck, which is going to connect the head of the femur with the body of the femur. Okay. We have our greater trochanter laterally and our lesser trochanter medially. Okay. We have, like I mentioned, the body of the femur, as well as our medial epicondyle and our lateral epicondyle. So this is all the anterior surface of the femur. Continuing down, we have our medial and our lateral condyle. This is where the articulating surfaces of our knee joint are. We have our patellar surface on the anterior portion of the femur. Moving posteriorly, we have our linea aspera, and moving up again, we have our pectineal line. Some important components of the joint capsule at the hip. We have our iliofemoral ligament right here anteriorly. This is also referred to as our Y ligament. This is the strongest ligament within the body. It resists extension of the hip, and it provides a lot of stability to the hip joint itself. We also have our pubofemoral ligament, and posteriorly we have our ischiofemoral ligament. We also have our ligamentum teres, which is located deep within the hip joint, and this is going to connect the acetabulum and the femoral head. There are a large number of nerves and blood vessels that are included in this structure, so if you have damage to the ligamentum teres, you can potentially also have nerve and arterial damage. This ligament does not provide a lot of stability to the hip. It is more for maintaining continuity as well as blood supply and nerve innervation. We have our acetabular labrum located here in this image. So this is a fibrocartilaginous component of the hip. It's considered an extension of the acetabular socket. What it does is it increases the containment of the femoral head. It helps with sealing and suctioning and positioning of the hip joint. It does provide increased stability, and it helps provide or distribute compressive loads during weight bearing. So the acetabular labrum is important for stability at the hip. We have our inguinal ligament located here. So this connects our ASIS to our pubic tubercle, and this forms the border of our inguinal canal. And lastly, on here I have listed our iliotibial band, but I don't have an image of this. This attaches from our iliac crest, and it passes down below the knee, so it crosses the hip as well as the knee, and attaches at the tibial tubercle. So the last thing to review are muscles of the hip, and I know that Enid went over this in kinesiology, so I'm going to refer you to her anatomy review for the specific muscles for origin, insertion, innervation, and action of the hip.